Hi, good afternoon, everyone. I got elected this week, so I promise my video won't be as long as the last one. So I know for those of you that like to just slip into a video really quick, hopefully I'll be one of those, maybe 5 to 10 minutes. So the whole purpose of the video this week is to talk about myth versus fact. Now you have to admit, some of the stuff out on Facebook is really funny. I'm trying not to laugh because I read a ton of it before I prepared this. It's like, stay in the house. No, don't stay in the house. Wear a mask. No, don't wear a mask. No, go to the pharmacy. Don't go to the pharmacy. If you're sick, do that. Everybody likes telling you all these different things. So I'm going to highlight about 8 things today of things I want to clear up so that everybody's understanding whether it's a myth or whether it's true. So in the beginning, I'm going to start with some factual stuff. I think that's very interesting. The myth is Californians have been on restriction since March 19th, and our numbers are no better than the people that are getting to go out. Okay, this is what people are saying. So I looked at that and I thought, is this really true? And just bear with me for just a little bit. I wish I had it on PowerPoint, but I don't. The top 6 states in population are as follows. California is the first, then it's Texas, Florida, New York, Pennsylvania, Illinois. These are the top 6 most populous states, California being the top. We have over 39 million people. That's a lot of people. Okay, with all of that, who has the number of deaths? We all know New York. New York is the top, has 20,000 as of 20,354 as of today. Okay, these numbers are changing obviously by the minute. And in California, we have 1,437 deaths. So in comparison to all the deaths of all the states, we have the 9th highest amounts of death. But because we have the most populous state, let me explain how that is. Deaths per 1 million. New York has 1,037 deaths per 1 million. They're number one in the country, which of course we know they're going through a terrible time. California has 37 deaths per million. We're number 29th of the 50 states. So what does that mean? It means that because California did start our social distancing early, we're actually doing very well considering our numbers. LA County alone, I know we're seeing our numbers go up. You have to remember, LA County has 12, 13 million people just in that area. So I just wanted to say kudos. Another thing, positive cases per million were 32. We had 963, whereas obviously New York has the top at 13,368. So I just wanted to let you know that the social distancing that is in place, the fact that California and our governor kind of pushed it a little earlier, I think is really good. Second thing, can your pets give you coronavirus? Are you all giving your answer? Yes, no, everybody raising their hand at home, fight about it. Bring the family in. This could be entertainment for you while you're stuck in the house. So the answer is, we all know that the virus came from a human eating an animal that had eaten a bat. We think it came from what they call a pangolin. And a pangolin is kind of the scaly little animal, and they think that that's how the whole thing started. Moral of the story, be vegan. No. The moral of the story is we know that it's a zootic virus because it originated in animal. It's not been generated in a lab. It's not been created. It came from an animal. So can we give it to animals? Now, we all know that there's 2 cats in New York, one in one part, one in the other. They developed a dry cough and they were tested, and lo and behold, their symptoms were mild, but these 2 cats had coronavirus. Now, did we give them the coronavirus? There's probably a good chance. We don't have any documentation one way or the other. But in the lion, that's right, there was a tiger, I believe, in the Bronx Zoo, that same thing was tested positive. So there's this feeling like maybe they're getting it from us. Are they getting it from a contaminated situation, whether airborne or touching something? We don't know. But at this point, the chance of them giving us coronavirus, it's very, very small, minuscule. Of all the cases that we have in the United States, we're talking 2 that we found out 2 cats had it. So I love that all the adoption centers, they're open. There's no more dogs to be adopted. You see it on the news. It's really exciting. So I think keep getting your pets. I don't think we need to worry about it. Another thing, masks prevent corona infection. Okay. True or false? False. Okay. The recommendations to wear a mask, it's for preventing you from getting COVID, right? The thought. But it decreases the risk of you, if in fact you have COVID and are asymptomatic or pre-symptomatic, it prevents you from contaminating the air or anywhere else around you. So that's why we wear it. And as you see, there's countries all over the world that are wearing it because we don't know. Some studies that I've read, 25% of people that have COVID never develop any symptoms. So how are we ever going to track where it's safe when it's not safe? Whereas if we all wear masks, number one, it prevents in case we are sick for when we sneeze or if we're coughing. We're just protecting the exposure of it. But also it's reminding us what? To not touch our nose and our mouth with our hands, which is an entry for the disease. So best thing to do, don't touch your eyes and nose, keep your mask on. Social distancing is the best way to not get COVID-19. Okay, coronavirus does not affect children. Fact or myth? Okay, it's a myth. It's true there are fewer reported cases. They're saying that children 12 months and below can have an adverse reaction, but there are very few reports of it. So for some reason, we don't know if it's because their immune system is so fresh because of all the immunizations they've been getting on a regular basis. They seem to do better, but they still can get coronavirus. We're seeing it across the country of different youth, different children of all ages that can get it. So the answer is yes, children can get COVID, but yes, they are not seen to get it as often as adults are. Another myth. I heard that I need to decontaminate my groceries when I purchase them. Is this true? Myth or truth? Now, some of you are probably saying, true, I discontaminated all my stuff that comes into this house. And you know what? I say, that's wonderful. If you have the time and you can do it, I think it's great. It's always good to be safe. But do we have to? Probably not. Unanimously, the government claims that there's probably little risk to especially cardboards and stuff. You can wipe it down if you'd like. Absolutely, if you can. Are the foods, we're hearing that there's COVID in these meat factories. We are hearing of no transmission from something that you're eating. From meat markets that we hear, they're having some outbreaks. At this point, it is not something that we are ingesting and getting active cases. Now, we're still shooting at a moving target. We do not understand all the properties of the organism. We're still learning about it. We're still learning what it likes, what it doesn't, how it lives, where it doesn't live. So these things are obviously changing. But the question was, we claim that there's very little risk from you getting something from ingesting food or from the food packaging. Okay, another myth or truth. Warm environments and heat will kill the COVID-19, so we'll be safe this summer. True or false? False. Why is it false? Look at Singapore and look at places, Australia, they're having beautiful summer weather and they're still having issues with COVID. So that's a myth. Okay, next one, social distancing. Should I seek care or should I not when I'm sick? You hear that a lot. I'm sick, but they're telling me not to go to the hospital. So the truth is, if you are urgently sick, you feel like you broke a bone, you're feeling chest pain like a heart attack, you're feeling neurologically very dizzy, anything that seems emergent, absolutely come up to the emergency room. We are triaging everyone that comes up here to prevent people from getting COVID. If you have all the signs and symptoms of COVID, yes, we may not allow you to come in and send you home to protect you and to have you managed at home. But if you're having severe shortness of breath or anoxia, we're going to bring you in and care for you. So if it's an emergent situation, you will be triaged. Always come up. Now, what about clinic case? What about, do I need my medicine renewed? Or I don't know if my blood pressure's been under control. I'm not quite sure if my diabetes, all of those things that you're not sure of, call a provider. Let us sit down and make sure you're in the best health you can be. We don't want you to be in a compromised state when in fact things start to get lifted and visitors were going to be coming back from the mainland and you may in fact be exposed to COVID at one time. Always need to be in the optimal strength. Okay. The coronavirus death rates are being overreported for political reasons. I don't want to get into any of the political things of all of this. I've heard it. Is that a truth or is that a myth? Let me clarify. There's some validity in what they're saying, but I want to explain why it's being said. When patients die, they have to know the cause of death. Well, we all know that the amount of tests that have been sent across the United States is not nearly as many as we needed. So people are dying in their homes, people are dying of pneumonia, and we have no idea if it was COVID related. So what they're trying to do is ones that seem similar. The anoxi came on quickly, they were found at home, and they have certain criteria. Those are being pulled in, but not all deaths. I heard someone say, well, what about if it has an unrelated symptomology, it doesn't get pulled in. So it's not that we're trying to over-report. What we're trying to do is under-report. Just like now we're hearing that as we're going to start to do antibody testings, that maybe a lot of people have been exposed already. And if they have, then all of these numbers are underreported anyway. It's just because we haven't tested as many people as there are, or we would show that we have even more positive cases. So it's kind of like that same thing. So now we are not over-reporting. We're just trying to not under-report. To this day, there's probably, I've read studies that feel that we've underreported in a lot of these states across America because it's been so hard to keep up with the pandemic. Okay, I have 3 more. We've been together for 11 minutes. I'm trying not to talk so fast that I lose you, but we're moving right along. The coronavirus can live in the air for 3 days. Myth or truth? I have read so many different articles since this whole thing started as to how long. I've heard that a sneeze can last 8 minutes. I've heard that singing and coughing can leave some particles for 3 hours. I just want you to know I've not heard anything like 3 days in the air seems a little bit off. However, they are finding, and they're not quite clear on, is how long does the virus live in the vents? Which leads me to how long does the coronavirus live on metal surfaces? We heard at the beginning of the pandemic that it could live up to 7 days. And then we've heard other sources where if the substance is soft or porable, like cardboard or cotton, it's important to clean your clothes. It's important to wipe things down. But the thing that obviously keeps it the longest is metal. I really think that there's some discrepancy. I've heard different studies say different things, but one thing I do want to say, in the healthcare world, we know that hepatitis B, which is one of our bloodborne pathogens that we can be exposed to when we care for people, lives on surfaces for 7 days. And hepatitis C, which is another hepatitis bloodborne pathogen, can live up to 21 days. That was important for us as healthcare workers to know. So with this whole coronavirus, obviously, more of the transmission is through airborne, and that's why it's so important for social distancing. The most important thing you will ever do to protect yourself from getting coronavirus is not being within so many feet of a person that has it. No question. Hepatitis, it's more of a bloodborne thing. We wash our hands, we wear gloves, we protect ourselves from that. So social distancing really is the biggest and most important thing you do, which leads me to the next myth. How are we all going to get immunity if you keep us in the house? Truth or false? Can we get immunity without being exposed? This is the answer to that. The reason why we have you in your house is because we don't know how to treat the virus effectively. People are dying when they shouldn't be. People that are young, children, babies. We do not want to have the loss of life that we're seeing now. And until we can figure out the perfect drug combination to keep people from dying, as long as we can keep people apart from each other, it buys us some time, and hopefully whether it's a vaccine or the perfect drug combination, when in fact we all have to get back around each other, some of us will have immunity because we've already had it and just didn't know it, because many of us that have it don't ever develop symptoms. So we'll begin to test that. But we're just kind of buying time. I think like with chickenpox, people used to say, why can't we just have a chickenpox party where if a kid has chickenpox, you send your kid over there hoping to get it over with. We're not at that stage with COVID. We don't know enough about it, and too many bad outcomes happen. Chickenpox, you just get a bunch of scabs and itch and fever, but usually the mortality and the lethalness of the virus isn't anything comparable to what we're doing with coronavirus. Last, should I go to Leo's when I'm sick to pick up my medicine? I guess that's more of a question than a truth or false. You do not need to go to Leo's when you're sick. They have delivery. We can call a friend, call a family member. Someone can go to Leo's and pick up the medication for you. I think it's important when you're sick to not be out on the streets. So what did we learn about with the mask? The mask somewhat protects, but it's not foolproof. Even N95s that we work in the hospital, we have to like go through all these testings to make sure it's fit just right and then we put it on just right. So again, if you have symptoms or you know you've been exposed to COVID, stay in the house for at least 2 weeks. Let somebody deliver it to you, drop it off on your porch. That's the best thing you can do. And if you are well or you're going to Leo's, think of the treat. You're at Leo's, maybe you can pick yourself up a puzzle, or you can do a painting or color by painting, something to help with the boredom that you're having while you're stuck in the house. Anyway, another shout out to everybody. Thanks so much for honoring the social distancing. Thanks for tuning in, and we'll see you again in the next few days.